Thank you for joining us. So I think, doctor, for a lot of people who maybe have not dealt with heart disease before, they might not have heard of a polypill. What exactly is it and how do they work?
Good morning, Emery. Yes, a polypill means when a combination of drugs is put together to create one pill.
But I wonder if there are any potential side effects or dangers when it comes to polypills.
Obviously, there is a little bit of one size fits all approach here, and this could not be feeding everyone. You have to adjust, at the individual level, the doses. Some people might have side effects that could lead to the discontinuation of a whole pill. But in general, from the study we just recently seen published out there, the incidence of side effects are relatively low.
So why then are polypills not widely used in the U.S. and how can they affect the treatment of patients?
That's a great question because polypill turns out to be very cost effective. In the United States, it did not gain much traction, although it has been developed since 2003 by about half a dozen companies, is because it includes generic drugs, and those are very cheap, and there is no economic gain for big pharma to invest in them, first of all. Second, in the United States, people do prefer individualized medicine. They don't want the concept of mass medication.
So how can a polypill help countries with big health disparities and problems? I mean, you can count the U.S. among those countries, but there are probably other countries where the gap is even wider. How can they help when it comes to accessing healthcare?
As you said, Emery, heart disease is #1 killer, and 80% of these deaths occur in low-income countries. So just creating a pill that's cheaper, affordable, would fill that gap for those people who do not have access to medication. So I think from that perspective, it will be a great addition to the arsenal we have for fighting heart disease.
And how can a polypill like this not only help financially? You mentioned that they're a lot cheaper. Part of the reason they're cheaper is because they also incorporate generic drugs. But how can they help financially, but also make life easier for physicians and patients? Because having a good relationship between physician and patient goes a long way.
If a multi-pill fill into someone's regimen and there are no side effects, it's great. #1, because we know simple treatment, simplified regimen can increase the adherence to a medical treatment by 44%. That's huge. And second, imagine elderly. Half of them are not able to handle their polypharmacy. So having one pill for them would be incredible.
Yeah, I think it makes a lot of sense. Like, I'm thinking about my own dad and just listening to him complain the other day about having to take many different pills, not for heart disease, but for other things, and having to keep them all organized is, it's like a part-time job for some people. So I can see how this could make a huge difference. Dr. Louisa Petrie.